Awesome. Okay, so we're on sales call number 3 of the year with Dr. Grody. So you're going to talk about emotional versus logical selling. Is that correct?
Yes, the emotional versus logical brain and how we can integrate that into our daily sales.
Awesome. I'll pull up your presentation and you go ahead and give us a little bit of an intro.
Sounds good. So as we're going through today, we're really gonna, forecast how we should be presenting our words and our spiel in terms of targeting the emotional brain rather than the logical brain. So the biggest takeaway I want everyone to remember from today is that logic equals lethargic and emotion puts people in motion. So if we're gonna, explain away everything that we do, and I'll give some examples today on how we can explain logically versus emotionally. But the biggest thing is as we went over in our last few calls, you really want to cast the value and get them bought in terms of what value is this going to provide to them and why would they, want to be interested. So really the target today, like the slide says, is the brain focus selling. Go ahead. Okay. So logical, like I said, lethargic, right? Logic, lethargic. Let's keep those two terms together. So it loves the explanation and analysis, kind of like a computer. So if we were to relate this to physical therapy, like I'm a physical therapist, I have my doctorate, I can help you. I've treated, shoulders, hips, knees, ankles. Oh, and you want to come for your shoulder? I've done many of those. You're already lost in the sauce. So you're not going to be bought into kind of the services that I provided as a clinician nor the services that everyone on the team provides. So the emotional brain makes decisions based on feelings. So say Kelly comes to me and she's like, I have 4 kids. I can't go to their sporting events because if I sit longer than 5 minutes, I feel this numbness and tingling down my leg. And if I'm like, well, after one visit, I could get you sitting there for, at least 15 to 20 minutes, and we could work on you getting up more frequently. She's like bought in because she's not able to go to these sporting events right now. That's holding her back. If we can tie an emotional piece to it, it's going to allow her to be more bought into therapy and want to pursue our care. All right, here we go. A little lethargic. So this guy is like running out of juice. He's so tired because he's been listening to all the spiels that we've been providing about all of our services. So it slows people down too. So if I'm going to explain a whole story to someone, they're not concerned about what I have to say. They're concerned about what's in it for them, right? So you lose them in the detail. They get overwhelmed and then they're like, I guess maybe I'll think on it. I'm not really sure. Thank you for your time, but maybe I'll reach out to you. And you're like, okay, that's not what I wanted. So really when, there is a time and a place for the logical aspect of it, and we are doctors, so we like to say, we have credentials. We were just talking about this before, right? The doctorate degree. However, we want to make sure that we're tying it to the emotion first and then kind of explaining after. And honestly, Kelly and I went over this a lot. Save the explanation for the visit. When you're going through everything with them, save that for the visit and get them to buy in before, because that's going to allow them to take that next step, which is maybe booking that 15-minute free injury consult or even an evaluation. All right. So emotion works on desires, instincts, and feelings. So if I'm in a desire to do something, I'm going to be more apt to book. And if that desire is so intense, it's not even going to be a decision. It's going to be, boom, I'm already bought in, I'm going to do it. So for instance, if someone's like, I have a half marathon scheduled in 3 months, I injured my knee because I was walking my dog and there was another dog and they pulled me and now I just have this bruise and I just always get knee pain when I'm walking. And then what do? We say, oh, after one visit, I can have you feeling better and, get you out of pain essentially. But even after one visit, we can work on some manual therapy techniques and really make you feel a little less pain. Is that something you'd be interested in? And they're like, well, yeah, like obviously I want to run that half. And then, after that, you can get into the nitty gritty of what that's going to look like from a, exercise standpoint once you get that pain sensation down, to progress them into the realm of running again and, being more comfortable and confident with it. But their direct thing right then and there is going to be their pain. So how can you tie that one thing versus like all the things, right? We got the half. Okay, well, I need to work on their gait. I need to work on, no. They're going to be lost if you go into all that. Focus on the one thing. They have pain when they're walking. Okay, if I can get you in and reduce your pain in just one visit, does that sound like something you would want? I mean, no one's going to say no to that. So, like, have them buy in. And like Kelly has talked about, if you didn't watch the last discussion, like getting the nod. Like, yes, I want that. Like, that's what I want. Okay. They're not even thinking about making a decision. Like I said on the previous slide, they're instinctually going to book that. And they're feeling heard and they're feeling like, oh, yay, maybe I can run that half, you know? So that's really, really, truly essential in the selling process. All right. So the importance of emotion. So facts don't have emotion. I'm a doctor of physical therapy. Woohoo. We're all excited to be here, right? But there's no emotional tie to that. It's just a straight fact. There, it's neutral. Neutrality is the key of facts, okay? President, right? Things like that, date, they all are facts. However, they don't have a story. The story that you attach to the facts create the emotion, right? Pain. Pain is a subjective measure, right? That is a fact. Now, you have knee pain because you fell when you were walking your dog and they pulled you. That's going to tie an emotional response to them, and they're going to be like, "Oh, yes, I did do that," and they're bought in. So, really tying that emotion to how we can help as clinicians is super important. So, another solid example would be like going back to the one that I had said with Kelly, like maybe she's not even able to attend her children's sporting events to the fact that she can't sit for that long. So she feels like even driving them there is a problem. So if you can, cast that vision to the patient that, even after one visit, they're going to have less pain when sitting, and you can, springboard them into the next line of treatment, like, oh, we'll work on that initially, they're going to feel an emotional tie to that because they have been in a negative mental state for so long that they're already sold. So I think the biggest thing is like use the facts that the patients are telling you and cast a story and a vision and try to pick like one specific thing. So Kelly could have told me her entire story, but the thing that stuck out to me the most is the fact that she can't sit for her children's sporting events, and that's what she wants to get back to. So use that and then focus on that versus like, I want to do this and this and this. And then they're overwhelmed and they're going to be like back to the logical brain of, I got to think on it. Okay. So again, just kind of reiterating the importance of the emotion. Okay. So selling PT with emotional versus a logical mindset. So big things are, we always like to explain away like who we are and what we do. I know we had a great conversation before this discussion about direct access with David here on the call today. So the big thing with cash-based PT is we're awesome at what we do. And the beauty of cash pay is we don't have limitations for insurance. So we want to tell them all the things we can do. We're going to perform an eval. It's going to be awesome. We're going to go over all your range of motion, your man and muscle testing. And I'm going to create you a formulated HEP. It's not going to be from a drawer. It's going to be one that I created and I spent time on. Then I'm going to do some manual therapy techniques you probably never see in the clinic, like some dynamic cupping, which a lot of people just do when you're laying down. And they're like, what? Like, I'm not that interested in that, right? But the big thing is like, I'm going to use an ultimate frisbee example here. Is that, okay, I'm going to determine why your right shoulder pain is not allowing you to play ultimate. And then we're going to get you back on the field ASAP so that you can win with the team this season. Does that sound like something you'd be interested in? And they're like, yeah. And then if they're like, but, I'm really worried about my shoulder still hurting. Okay, well, we can minimize your pain with just one visit and allowing that right shoulder to feel less of a limitation for you and more of a, just kind of blip in the road, if you will. So I think the biggest takeaway from this presentation, it's not super long, it's not supposed to be, is that we want to, cast the value of our service, but we want people to feel heard first so that they can tie that emotion to their visit so that they're bought in and sold. So for example, if you have someone who's on the fence about PT, maybe you're in general conversation, if you're marketing yourself to friends, family, what have you, you're at an event, and they're like, I've been dealing with this nagging pain in my quads. You could maybe just use an example from a patient that you've treated and how they felt after just one visit. And they're like, well, one visit, like I thought PT was supposed to take super long. That's another thing too, is like, there's already preset conceptions of what physical therapy is. So if we can create a new vision utilizing one piece of information of what we perceive in terms of like the shortened timeline of cash pay, that is a huge selling point. I don't have to see you for 12 visits, but just after one visit, you're probably going to have less pain than you do currently. They're going to be sold and bought in, and they're going to want to keep up with your treatment regimen because it's not just this mundane monotony, if you will. It's going to really allow them to get back to what they love in less time. So, questions. Let's open up for questions. What questions do you guys have for me? That's the last one.
Had to unmute. It is
You're good.
interesting, right? That and David, feel free to unmute and we'll just have a conversation. We got about 10 more minutes. It's
Yeah.
interesting, like in when you learn marketing and sales, they talk about finding the pain point, and we
Mm-hmm.
literally have a pain point. Like
Mm-hmm.
that's why they come most of the time is actual pain. But I want to, like you said, we have all this education, so I want to explain all of it.
Mm-hmm.
Versus like that's a totally like blows my mind thinking about like no, I need to like cast a vision of where they can be after working for me. Like I need to frame that thought.
Mm-hmm.
It's a very different concept because I feel like you in insurance based and traditional healthcare, you don't really have to have people buy in. Like they just have to come. Like
Mm-hmm.
Mhm.
you want your MRI? Okay, do your 12 visits. You want your surgery? Okay, do your 12 visits. Oh, my doctor said I got to do 12 visits. So there's nothing, there's no, we never learned a buy-in, you know?
No, for sure. And I think the thing is too, is like if they get into questions too, and this is something I thought would probably come up about, insurance and the difference between, and like we do have to explain a little bit. We recently posted on our social media, which does a great job kind of casting the vision, but when they come in for that initial visit to the PCP, it's going to likely be a $60 copay before they get FaceTime with their primary, who's then probably going to refer them to sports med, who's then likely going to say, hey, I think you might need an x-ray or an MRI. And then at that point, we'll probably refer them back to sports med to get referral to PT. And then we're maybe like, 6 to 8 weeks in already, and we have no answers. So that, knee pain or shoulder pain that was bothering us is just in this like continuous cycle. And we've seen that time and time again throughout cash pay. It's like people don't want to jump through the hoops. They want to just get better now. So that's why I really wanted to cast the vision too of like timeline, explaining to them like after one visit, like what can you provide to me in one visit? If you're not going to do anything for me in one visit, I'm not going to keep coming back, right? Like if you get that buy-in in visit one, right, you got to get them to buy in to even schedule the visit. But if there's no emotional tie to that, initial phone screen or that initial evaluation, they're not going to want to continue service. So it's really a continual buy-in, if you will. It's totally different, like Kelly said, from the insurance-based realm. And we see this time and time again with, the outcomes, right? Like after like 4 or 5 visits, a lot of people are solid and they're gone. And you're like, whoa,
Yeah.
like this is not traditional PT. So I think using those examples too of specific patients can be so valuable in getting that emotional buy-in.
I think you brought up a couple of good points that I'm going to be starting to use. The short-term deal aspects of it is a really good idea. I like the idea about the buy-ins that you get them to do the buy-in for it. I think I have failed miserably on that in the past, and I like the way that you handled that and your ideas for that. So I'm going to start using those same ideas.
Thank you.
Um, you're welcome. And that's just being totally honest. I've got an example of cousins that always say, "Can you do this for me?" And I show them how to do it in the past, and 6 months later they say, "Can you do this for me?" And I show them how to do the exact same thing again for the exact same idea.
Yeah.
And I started saying, well, if you want to do a little bit of a buy-in for it, now I don't use the word buy-ins, but sign up with concierge and then we can do it. And I haven't got anybody to do that yet. But I think you just answered my dilemma, if I can call it that, for getting people to sign up is because of the short term, and I think that your presentation just answered something I need to work on myself
Awesome.
to get them to do that. So that was a good learning experience.
Good. I do have a question for you, David. So with
Yes, ma'am.
family and friends, like I feel like Kelly and I run into this a lot because we've both given a lot of things away for free. But one thing we've really learned is if you want someone to take you seriously, you need to have them pay, even if it's
Yep.
family. I've treated a couple of family members this year alone, post-op surgeries, and I had them pay. And I normally wouldn't do that. But I tell you what, the results were a lot better and more streamlined and they took me seriously versus
Yeah.
me like I've been in situations like you where I can give my dad a shoulder program and I'm like, hey, have you done your rehab? He didn't pay for anything. He's like, no, I've been busy at work. So they
Yeah.
just don't take it seriously. So I think too, like I love that idea of, casting the vision of, hey, like we just talked about this a few months ago, But you know what? If you come see me through concierge after one visit, I can assure you I'm going to reduce your pain and you'll be feeling better. And then if you want to keep getting better, you need to do the exercises that I'm giving you. And if they're going to pay for your services, they're already going to be quote unquote bought in, right? So they're going to want to continue that line of treatment and be diligent with it versus just like, oh, I guess I won't do it, you know?
No, I agree with you. You know, I've been doing it for years, and it seems like everybody wants everything for free, but there is no value for free.
I
Mm-hmm.
think you
It's
said that in
not,
a call like months ago, David. I want to say it was you, how you were like, if you don't place money on it, you don't place value on it. And so then
yeah.
it's obsolete. And that like that blew my mind. It's something so simple, but I want to say you said it like back in the summer of last year. And I was like, that is so true. And that is why when you do things for people for free, they don't see the value in it. And so they don't use it. Well, if they don't use it, they don't get results. So then you think, oh, well, this thing must not work, but it hasn't been used correctly. And one of the sales classes that Shania and I took, they talk about, I want to say it's you have the expert and then you have the professional, and you can't cross over from expert to professional until money is exchanged. So they have like a visual of it. It's like expert, professional, and here's the money. So as the expert, I have opinions and I have, the knowledge, but like I haven't even earned the right to give that to you. Like, I don't need to be getting out in your business. Like, you may not be equipped to handle what I'm going to say until we set up that relationship and that money crosses hands. It's not a money thing. It could be reduced. It could be a low ticket item, I guess you could say, but it's that switch from that payment. Like, oh, you're not just the expert. I'm actually going to hire you as a professional because I pay you. And so I put value in that because
Mhm.
that value follows the money.
Exactly. And it's just really kind of strange because you'd think people would value the idea of getting free treatment, but for many, 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 many years, they would ask the same question for the same malady that they had, and it probably was me because I've been telling people don't treat your family and friends for free.
Yeah.
There's no value for free. And it might have been me, and I think it was. I think we had a conversation about that about a year ago, and I've stopped treating for free. I won't treat for free. I haven't done a whole lot of treatment since then because of that, but that's okay because I like for today the way this was set up. For me, it's an eye opener. So there's a Bang product here that you just brought up, and I'm going to use it with that one, and hopefully with the doctors I can do the same thing so I can get the thing going and make sure that it works. But I, you know, one idea for, I don't know if Shania or you even do that, but one of the things for easy treatment for fast that I've used in the past with, especially at the Air Force Base, was total motion release. I'm certified in that one, and it's a movement treatment, and it goes against the realm of physical therapy. I'm just be upfront on it and tell you it goes against the realm. Such as if you have an ankle problem or a knee problem on your left leg, use the right leg to treat it. And it sounds counterintuitive, but it works and it's fast. And I use that a lot at the base, and I've been trying to get people to sign up to do the concierge thing, but the internet for a lot of people seems to be intimidating. I guess it's where I live at because a lot of people aren't real computer savvy, but that's the realm I get to get past, and if I can, then I can get them to start doing stuff. And if I get this one doctor on board in June, then I think it's going to start taking off.
Yeah.
Yeah, that's a great idea.
Yeah.
Yep.
And don't undervalue the conversations that you can have just throughout town if you are out and about, because there's still room for just the traditional pounding the pavement, knocking on doors. I mean,
Yeah.
really is.
Yeah.
Hmm.
There is.
And I think like handing out your business cards and just like being that face. And I think another thing too is we didn't talk about this, but like back to the friends and family point, until that money is exchanged, like Kelly had mentioned, a lot of our training that we have done, you go from that familial member or friend to now professional. So you
Mhm.
are
Mhm.
the doctor versus before you're just the friend or the family member. You're not a doctor of physical therapy. So I think casting that vision too, is going to be really important to all of our therapists because we want to give, we want to help. That's who we are. So I think just changing the mindset and really reframing how we approach things and just verbiage, like using our words, can really elicit the sales and really elicit change. And Kelly and I have both seen that in our practices within the last few months of,
Yeah.
doing this training and just changing our honestly just the way we speak and explaining less and tying it more to emotion and value, because if they're emotionally tied to what you're saying, even the doctors, right? Like if you have, specific patient instances, if they specialize, I don't know whom you spoke with, but using the same tactics that you're going to use on your patients on those doctors and professionals can be really helpful too, because they're not going to want to send patients to you unless you have good outcomes, right? Because then it's like, well, I sent them there and they didn't do a good job, so now I look bad. So I think just really, really casting that as well to your marketing throughout town or wherever.
Yeah.
Yep,
And picking
I
the
would
one
agree with
thing,
you.
Yeah.
pick the one thing that's like important. I've done some marketing to physicians where I just was like throwing everything at them. I can do dry needling, I can do cupping, I can do manipulation and exercise, and I'll do this and I'll do this. And it's like, I don't want to deal with you. It's too much going
Yeah,
on, you know?
yeah,
Yeah.
no, I understand that. And you can, I guess in some ways, if you tell people all the things you can do for them, it kind of scares them, especially for a lot of people that don't like the needles, but I do a lot of needling, or I did when I
Yeah.
was working.
And it's
Yeah.
just hearing their story and like, how am I going to frame that story for them? Like,
Mm.
where do they place their value? Another thing we learned was we're giving away all our material. And
All right.
another thing that like sat with me was like, don't assume where their value is. Like, I would assume that, that the lady before Shania described that like maybe like her biggest thing was she couldn't sit through their kids' games, but it might not be. So like, it might be that she can't stand up to cook every day. Like it might be something else. And that might be where we need to shift how we reach that emotional side of the brain.
Mm.
Because if when you hit that, it's like, I will do what it takes to
Mm-hmm.
get to this picture she just made for me.
Mm-hmm. And it might change too. Like Kelly said, like maybe they're better than sitting for the games. And they're like, well, now I'm having pain here. So it doesn't have to be like a one and done, but it does have to be a one and done at that instant. So it's
Yeah.
not like you need to just stay like blinders on throughout the entirety of their treatment, but that emotional time may shift as they recover in their rehab. The thing they couldn't do before they now can, but now they can't do something else. So how can we keep kind of reframing and, building a new outlook for them in terms of that emotional tie and belief so that they still are bought in, even after we get them over, say, like hump one. Now we got to get them over a hump two. Now they can't stand and cook dinner, like Kelly said. So I think that's important to know too. 'Cause sometimes as PTs, we're like, it's B. We're going with B. Like they said they couldn't do this, so we're going to do that. No, they can do that now. So now what else can we help them with to get that emotional tie in those successive visits? So yeah, that's really good.
That
Thanks so
is.
much, Shania. This was so helpful. We'll do another one in 2 weeks.
Yep.
Probably focus more on marketing. But I hope you
Okay.
can join again, David, and then we'll of course post this for everyone else. So I hope it's as helpful for them as it is for us.
Is it going to be on the 27th?
Let's see. I'll stop the recording.